What is dysautonomia? Dysautonomia is an umbrella term that means there is an abnormal functioning of the autonomic nervous system, our body's automatic regulator of bodily functions that we don't need to think about. Some examples include blood pressure, heart rate, breathing, temperature, digestion, urination, and other functions. It should be emphasized that dysautonomia is a descriptive term and not a specific diagnosis. It's like saying you have a headache but not what's causing the headache. What are the more common forms of dysautonomia? The three most common forms of dysautonomia in long COVID include, number 1, orthostatic hypotension. This is an abnormal drop in blood pressure when standing. It can lead to symptoms of dizziness or lightheadedness, but also shortness of breath, difficulty thinking, and in some cases nausea, headache, or neck pain. Patients may experience partial or complete loss of vision due to decreased blood flow to the brain and may in some cases lose consciousness. Number 2, postural tachycardia syndrome or POTS. POTS is a syndrome that encompasses many different symptoms, but is at its core defined by an abnormal rise in heart rate when standing. This can lead to the same symptoms as in orthostatic hypotension, as well as a host of others that are not related to posture, such as fatigue, brain fog, digestive problems, temperature regulation issues, and others. POTS is typically seen in younger women and is the most common autonomic disorder we see associated with long COVID. Number 3, small fiber neuropathy. While perhaps up to 1/3 of POTS patients have small fiber neuropathy, it also exists in the absence of POTS. It is the result of damage to the small nerves of the body. Typical symptoms include burning, tingling, or stabbing pains either in the extremities or in the odd places like the trunk, face, or even the mouth. The pain can migrate and does not always follow a specific pattern. Many patients with small fiber neuropathy also have involvement of the autonomic system, with many of the symptoms of POTS mentioned earlier. How common are these autonomic conditions in long COVID? Some research studies indicate that POTS might be as common as 30% in those with long COVID. Small fiber neuropathy may also affect 10 to 30% of those with long COVID. Orthostatic hypotension is much less common, typically affects older individuals, probably 1 to 2% of those with long COVID. More research is ultimately needed to better understand the rates of these conditions after COVID infection. How are these autonomic conditions diagnosed? For the most part, you don't need fancy diagnostic tests. All you need is 10 minutes and a blood pressure cuff. Your doctor can check your blood pressure and heart rate laying down and then standing every minute for 10 minutes. You can also perform this test at home yourself. It's called the active stand test. Small fiber neuropathy requires more specialized testing, either minimally invasive skin biopsy or a more specialized test called a QSART sweat test that is only done in autonomic labs. It should be noted that these conditions can be caused by other medical reasons besides COVID, so it is important to have a thorough evaluation with your doctor. How are these autonomic conditions treated? While we are trying to find specific treatments for long COVID autonomic conditions, there are some general approaches to treating these disorders. In both POTS and orthostatic hypotension, the first step is non-pharmacological management. We recommend increasing fluid intake to 64 ounces daily and salt intake to at least 6 grams a day. This equates to around 2 teaspoons of table salt. You can put it in a Ziploc bag and add it to your food when cooking. Of course, if you have high blood pressure, you should talk to your doctor first. Compression garments can also help and include knee-high athletic socks, waist-high tights for women, or abdominal binders. Medications may also be tried and will vary based on the condition. Some may be used to increase blood pressure, while others may be used to lower heart rate. Graded exercise therapy is important in all autonomic conditions as exercise lowers resting heart rate and leads to improved blood flow. However, one should be cautious in those with post-exertional crashes not to push the exercise too hard too quickly. Small fiber neuropathy pain is treated symptomatically with neuropathic pain medications, and if another cause of the neuropathy is identified, one should treat the underlying cause. Of course, if you are experiencing any lingering symptoms of COVID-19, please consult your doctor first.